Ahead with compensation payments to infected blood victims, with the first being made by the end of the year. The size of the payouts will depend on individual circumstances, but could top £2 million. The infected blood scandal has been described as one of the biggest in the history of the NHS. More than 30,000 people were infected with HIV and hepatitis C from contaminated blood products and transfusions between 1970 and 1991. About 3,000 of them have since died. Many of them were haemophiliacs given these infected blood products as part of their treatment. Well, we're going to hear now from some of the survivors of this scandal, and we're starting with Martin Reid from Aberdeenshire, who was infected with hepatitis C in the early 1980s when he was a baby. He's questioned whether any amount of compensation will make up for the trauma suffered by so many.
I think the devil will be in the detail once we know exactly what the final compensation scheme will look like and the amounts that will be awarded. But it's worth bearing in mind that, people gave up their careers to perhaps care for a loved one. People lost mortgages. Parents lost children. Children lost parents, spouses, husbands, wives. So, there's been so much damage and trauma caused by this man-made, for the most part, avoidable disaster. So it's difficult to know if compensation will ever make up for the damage done. It will certainly provide financial security for many people, and especially people perhaps at the end of their life due to their illness. But, time will tell how easy the process will be to apply for compensation, and if the figures actually really reflect the true damage that's been caused to people.
Jill Fife lost her teaching career after her delayed diagnosis with hepatitis C after she received a transfusion following the birth of her daughter in Ninewells Hospital in Dundee in 1988. She says today's compensation scheme announcement has given her some hope.
For the first time, it became official that what had happened should not have happened. It should not have been covered up. And that a proper compensation should be paid. And what we've heard so far from Sir Brian Langstaff and Sir Robert Francis has given us a lot of hope. But, of course, the devil's in the detail. It will mean different things to different people. Some people have sadly passed away. Some people are still very, very ill, and they need the compensation just to survive. In my case, although I was very ill for a long time, because I wasn't told for 7 years and then I wasn't cured for about 10. But in my case, the illness and the resulting side effects, which are quite severe, have meant loss of opportunity. So the things that I could have done, that I was qualified to do, that I've worked hard to achieve, because of illness and tiredness, and especially lack of financial support, I wasn't able to take up opportunities I was offered.
And finally, Bill Wright is chair of Haemophilia Scotland, which represents people who received contaminated blood. He himself is a survivor of the scandal. Here's his thoughts.
I think people over the years have felt cheated, and I think it's going to take a very big leap of faith to actually believe that this is actually now happening. It, I think, for the first time, completely exposed the wrongs that have been done over the years and why people have felt so cheated. I think it's going to be nigh on impossible for the first payments to be made before the end of the year, as they claim they're going to do.
Well, let's speak now to Professor Katharina Hauck, who is co-convenor of the Blood Inquiry Report. She looked into the part on health and the health and economic cost of the tragedy. And thank you for joining us on the programme this evening. So, in terms of lost health, then, I suppose it must be quite difficult to put a price on it.
Yes, I mean, it was really difficult. And like the previous patient and affected person said on your show, it's about missed life opportunities. So it's about the lives that were not lived, or the lives that were not lived to their full potential. So we were actually commissioned by the Infected Blood Inquiry to look at the health and the economic impacts to the UK, but also to the individuals that were affected. And there's very little data really on how many people were infected, when they were infected, with which disease or combination of diseases. So we had to do some modeling and of hypothetical pathways of patients to come up to our findings, which are now in the aggregate. So we have found that of total life years that were lost due to the tragedy over the past 51 years, that's between 70,000 and 200,000 life years. And just to place that into context, COVID-19 in the Netherlands costs about 60,000 QALYs or life years. So that is quite a significant burden that this tragedy costed, and our heart really went out to everyone affected by this, and it was very emotional for us to work on this study.
I've covered this story quite a lot over the years, and actually every time it comes up, I just never really fail to be sort of continually saddened by it. That people were really just failed by the health service in such a horrific way, and then had to campaign for decades to try and get something out of it.
Yes, absolutely. So for us, it was important to do the survivors and the ones who died as well, and the affected families, to do them justice by doing the best job we could on the modeling, and not only look at the lost health, but also like some of the voices before said, on the lost productivity, the inability to work or to work as productively. And we actually estimated that these costs in terms of lost wages over the 51 years lie between 900 million and 2.6 billion. So quite a significant cost.
So how do you work out then who gets what? Because we've been discussing the story today, and the compensation levels are going to be different for different people based on their circumstances.
Yeah, so I wasn't involved in the compensation framework study that was conducted by Sir Robert Francis. So I can't really comment on that, but I think the Paymaster General in May said it's not just the harm caused by the infections that requires compensation, but also the wrong that was suffered by those affected. And that, of course, is a question that Sir Francis and colleagues had to address with their compensation framework study.
What about the cost then to the wider UK social care and healthcare service? Because of course they've had to deal with these cases.
Yes, absolutely. So we try to estimate that as well. And these are costs to the NHS, but also to patients, because some of the costs were borne by patients and their families. And we estimate that they, over the 51 years, lie between 900 million and 1.6 billion. We arrived at this estimate by setting up hypothetical patient trajectories. So we used data from infected individuals as much as we could, but we had to supplement that with other data and knowledge we had about the disease, how disease courses, and then we modeled sample trajectories of disease, if you so want. Some who died of AIDS very early, others who survived, but maybe got liver disease, received treatment, maybe several times for hepatitis C. So we costed the drugs, and we considered the changing drug regimen over the years in order to arrive at our estimate.
And do you think the estimates that you've kind up with, the kind of numbers you've come up with, would be a good factor in motivating people to make sure that something like this never happens again?
Yes, absolutely. I hope so. I mean, nowadays, I think the lessons have been learned. I mean, I personally find it a shame that it took so long, where in other countries where similar blood scandals happened, these inquiries were conducted in the 1990s. So that it took so long to get to this point and get an inquiry and